after this session, means Dr. Patil ma'am lectures. So please keep your mobile phone number ready, number which is connected with your bank account either, or you can prepare your means write down or type bank account IFSC name. Okay, you can raise the hand if we call that particular selected candidate. So these are the instructions for the prize winners that we will declare after these sessions. Now I request Dr. Neha ma'am to introduce our today's respected guest, Dr. Patil ma'am. Dr. Neha, over to you.
Yes.
Yes.
So today we have Dr. Jayashree Patil ma'am with us. She is currently working as HOD of Strirog and Prasuti Tantra Department, Dr. D.Y. Patil College of Ayurveda, Pimpri, Pune. She has been practicing as an Ayurvedic gynecologist since last 25 years. She is a Garbha Sanskar trainer. She has published many articles on Garbha Sanskar, as well as she has been conducting Garbha Sanskar sessions for pregnant women since last 15 years. She is NABH coordinator at Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. She has completed pre-assessment, final assessment, surveillance visits successfully. She is PG and PhD guide also. She has written a book on Prasuti Tantra, which is included in reference book list of Maharashtra University of Health Sciences, Nasik. So, ma'am, I request you to proceed with your lecture today.
Okay. Am I audible to everyone?
Yes, ma'am.
Okay. The topic today we are going to discuss is endometriosis. And being students of UG and PG, all of you know the definition of endometriosis. The endometriosis is presence of endometrium outside the uterine cavity. That all of us know that when the endometrium actually is the innermost layer of the uterus, but it is supposed to be present inside the uterus as an innermost layer, which is to be shed out at the time of the menstruation. But sometimes there is an abnormality, and this endometrium is seen somewhere else other than the inner layer of the uterus, and then it is called as endometriosis. So endometriosis is again of two types. One is endometriosis interna, and the second is endometriosis externa. So endometriosis interna is what? When the endometrium is going to be, all of you know, all of you know that the endometrium is supposed to be present inside the uterus, but sometimes the endometrial cells which are present, which are having engulfing capacity, that is, they are going to just in the area, erode the area in which they are present. So whenever there is adenomyosis, the endometrium is going to erode the myometrium of the uterus, and that is not supposed to be normal, because myometrium is having muscles, internal muscles and external muscle, and that's why we are supposed to see that the endometrium is actually, someone has disabled my video, so I can't be seen. I can only be heard. I have unmuted myself. So whenever we are seeing that endometrium is present in the myometrium, or the endometrium has eroded the endometrium, then the myometrium, then we can say that it is the endometrium is present. Yeah, it will be an audio lecture only. I'm getting some messages in the chat box, so please just listen to me. I think my voice is audible, and I'm going to explain it in a very easy language to all of you. That endometriosis is called endometriosis interna, when the endometriosis or is going to enter into the myometrium. The endometriosis is going to enter into the myometrium. Then it is called as endometriosis interna. And when the endometriosis is outside the uterine cavity, then it is called as endometriosis externa. So endometriosis externa is when the endometrium is present or it is just traveled outside the uterine cavity, then it is called as endometriosis externa. So what is the pathology behind it, or what are the causes behind it? So it is not that much specific. First we'll see the endometriosis. Okay. Since the we have seen that the endometriosis is uh, present inside the, when the endometrium is present inside the myometrium, then it is called as endometriosis interna, and when it is present outside the uterine cavity, then it is called as endometriosis externa. And the pathogenesis according to modern science. First, we'll see what the modern science wants to say about regarding endometriosis, and then all of us will go towards the Ayurvedic concepts of endometriosis. So what modern science or modern gynecology says that it doesn't have any pathogenesis, but sometimes there is a retrograding of the endometrium outside the uterine cavity. Then it can be traveling. The endometrium is traveling. Just the endometrium travels through the cervix, through the vagina, and then you can call it as a PV bleeding. So that type, the endometrium can get retroverted, and it can travel through the fallopian tube towards the ovary, towards the intestine, towards the rectum, or any type of bladder or any structure which is present in the pelvis, and that can be a endometriosis externa. So this is only retrograding of the endometrium or displacement of the endometrium outside the away than its normal side. So you can understand it is of two types. One is adenomyosis and second is endometriosis externa. So adenomyosis is what, when the endometrium is in the myometrium. So mostly what happens, the it just reaches inside the myometrium, or it invades the myometrium, and it is going to form some areas in the myometrium. The areas may be regular, the areas may be irregular, but the most important is it is not capsulated like fibroid. So whenever you want to diagnose endometriosis interna, or whenever you are, it is also called as adenomyosis of the uterus. So whenever you are going to diagnose adenomyosis, you have to differentially diagnose it with fibroid. Fibroid जो होता है, it is capsulated, and the interna is just the eroding of the endometrium, so it is not capsulated. It may be irregular, and it is thoroughly mixed with the myometrium. So adenomyosis is different and fibroid is different. So it invades deep into the myometrial muscles, and that's why there is an enlargement of the uterus. The uterus is going to get enlarged, and small structures can be seen inside the uterus, and the patient may suffer from the pain in abdomen. She may have menorrhagia, she may have some dull ache in the abdomen, or she may have some heavy feeling in the abdomen. And the most important thing in both type of endometriosis is that they are having pain. The pain may be dull ache, the pain may be severe, or the pain may be more severe in the case of the endometriosis. So the affected area, if we see in the myometrium, it is softer than fibroid. It is not hard, because fibroid is made up of muscle, and the endometrium is not a muscle. Endometrium is just these are just cells. So whenever we are seeing endometriosis interna or adenomyosis, we can see that the feel of the endometriosis interna or adenomyosis is not like a fibroid. The fibroid is capsulated, it is not capsulated. And if we go for histopathology of that part, then we can see some glands of the endometrium or some cells of the endometrium. You know, endometrium is composed of some cells. They are called as stromal cells, and there are glands in the endometrium. So if we go for the histopathology of these type of structures, then you can see that these are the some similarity. They are having similarity to the endometrium. So this is the way we are going to diagnose the adenomyosis. And the adenomyosis, sometimes the uterus becomes so much enlarged that it may take a size of 12 weeks or 10 weeks also. When we palpate the, all of you know that when you palpate the uterus bimanually, means by making PV examination or bimanually, then we can feel the uterus as a hard structure and the uterus is enlarged. And that time you can say that it may be adenomyosis. And sometimes fibroid also going to show the enlarged uterus, but you can say that by the feeling of the uterus, you can see the adenomyosis, or you can diagnose the adenomyosis. And these endometriosis disease, it is always observed, it is always we get in the patients who are in their reproductive age. Means we will not get the endometriosis in the girls who are having menarche or who are just married, or the ladies who are who have their menopause. So these two conditions are not very rare. Endometriosis is very rare in those cases. But when the person is actually active with her as a hormones, actively hormones are working in the body, or when the ovary is actively working, and when the patient is in a reproductive age of her life, then only we can see this type of complaints or this type of disease. So whenever you see, sometimes you can suspect of pregnancy when there is a adenomyosis, but you can always differentiate it from the pregnancy, because there is amenorrhea, and this adenomyosis is having menorrhagia, and the soft feel of the pregnancy is different by manual, and the feel of the pregnant uterus is different. But nowadays we are always going for sonography when we feel that there is something wrong, and by sonography you can easily diagnose that it is not pregnancy and it is adenomyosis. And as the age is in the reproductive age, the treatment of the adenomyosis will depend on the patient's age, depend on the symptoms she is having, or depend on the severity of the disease, or whether she wants to keep her uterus or not, whether she has completed her reproductive age. Means she if she is in the age of 40 or 45, she may not need the uterus, or the severity of the disease is so much that we need to go for abdominal hysterectomy. And sometimes if the patient is willing for pregnancy, if she is willing for pregnancy, we should wait and we should go for excision of some type of adenomyosis grows from the endometrium. So that is the treatment of the adenomyosis, which is the first type of endometriosis, that is endometriosis interna. Now we'll go towards endometriosis externa. So endometriosis externa is growth of endometrium outside the uterine cavity. The interna was the growth of the endometrium inside the uterus, but in the myometrium. Now the growth is outside the uterus, and it is in the ovary, it may be in the fallopian tube, but 80% of the patients, or about 70% of the cases, they are having the ovarian attachment most of the time. The ovaries are involved most of the time. Most frequent site for the endometriosis externa is ovary. And the second is pelvic peritoneum. Pelvic peritoneum, the patches of the endometrium are easily just seen on the pelvis, or they can be seen on the fallopian tube, they can be seen on the ovary, they can be seen on uterosacral ligament, or they can be seen in the pouch of Douglas also. So if we see a picture like that, so if you imagine a picture in front of your eyes, you will see the some small red colored inflamed patches, very red color patches outside the uterine cavity, and these patches are nothing but endometrium. And all of you know that the endometrium is just working, it is functioning according to the level of the hormones. So when there is a estrogen progesterone secretions, the endometrium is going to show the same changes as in the uterine endometrium. So when the endometrium is just embedded on the intestine, it is embedded on the ovary, it is embedded on the bladder. When there will be changes in the hormones, the endometrium will get proliferated, or it may get secretory some of the times, and then it can shed also inside the peritoneum cavity, and it will lie down here there in the pouch of the Douglas. So according to the patches and according to the where it has been taken place, where the displacement has been taken place, we can see the symptoms. So first of all, if we consider about the ovary, then if the ovary is the involved in this endometriosis externa, then there will be some disturbances of menstruation. There may be some disturbances in regularity of the menstruation, functioning of the menstruation, or there may be menorrhagia, and there may be pain yeah, on the side of the ovary. I think when there is a ovarian endometriosis, it is always both sides, chocolate cyst. So there are some changes in the ovary. There is a collection of the blood in the ovary, and then we can say that the chocolate cyst of the ovary is grown up, and this chocolate cyst is always present on both side, bilateral. Half of the cases bilateral chocolate cyst is seen, and it is diagnosed as a chocolate cyst, and ovaries are more of involved, and you can see the symptoms are, if the ovary is enlarged, the symptoms are pain in abdomen all the time, bilateral pain may be there, menstrual irregularities may be there. Now, if the endometrium has taken, means the embedding has taken place on the bladder. So if it is on the bladder, it may disturb the urinary symptoms, or if it has been gone deeper on the bladder surface, then it may be seen that there is a frequency of micturition, or there may be dysuria, or if it has already eroded the bladder wall inside, then also see hematuria. And intestinal part, if it is embedded on the intestines, then on the anterior wall of the rectum, then you can see that there are some disturbances in bowel habits. There may be pain when while passing the motion also, and you can see that there are some disturbances related to the uh, bowel habits. And if it is embedded on the uterosacral, that is posterior wall of the uterus and uterosacral ligament, then you can say that as the uterosacrals are attached to the sacrum, there is a severe backache in present in the lady. Means the pain in abdomen may be present when there is a ovarian involvement, uterine involvement, but when the uterosacrals are involved, there may be complete lower backache, and the patient is always coming with the complaint of backache instead of pain in abdomen. So backache is there, and if there is a pelvic involvement, then also she will have the pain at the area, or sometimes you see that there are so many patches but the pain is very less, or there may be only one or two patch and the pain is severe. So the pain is not reciprocal to the area of the embedding of the patches. So that time you have to be very much particular. You have to diagnose how it is, where it is, and how it can be treated, what is the age of the lady, and how we are going to see it is as a reproductive or non-reproductive. If the lady is willing for the children or willing for fertility, you need to take some another decisions. If the lady is not willing, if she has completed her reproductive age, you need to go for some another surgery. So it is a very complicated subject, and it is a very frustrating subject to the doctor also, and to the patient also, because the patient is always suffering from pain. The pain is the most important symptom of this endometriosis, and all the time she is coming to you, just doctor, please relieve my pain, please relieve my pain. And we are unable to do it unless and until we have divided, or we are able to shrink those patches, or we are going to disturb those patches, and it is not that much possible work for us. We have to go for so many type of treatments for the patient. First we need to go for relieving of the pain. In any type of pain, you need to give some painkillers as an allopathic treatment. Then you need to go for some hormonal treatment, where there will not be any growth, or the endometrium will get shrink, and the endometrial patches will get shrink. There are some medicines like progesterone, if they are used, there is a the effect of the estrogen on the patches is a little bit less, and then you can see that there is a somewhat relief to the patient. There is a somewhat relief to the patient because of giving oral contraceptive pills also. Sometimes these patients are are given continuous dose of oral contraceptive pills, and when the continuous dose of oral contraceptive pill has been given, then you see whenever we in our OPD, when patient are having oral contraceptive pills, you always see that they are complaining of some bloating sensation, they are complaining of some weight gain, they are complaining of some other symptoms. And now if the patient is taking the continuous oral contraceptive pill for 5 to 6 months, always she is going to have some side effects of that. So that is also very much disturbing. And there is one drug called danazol, which is also responsible, and which is going to suppress the production of FSH and LH. And because of suppression of FSH and LH, the menstrual cycle is not there. It is disturbed, and there, if you go give it for 6 to 9 months, you can see that the patches of endometrium are just shrink, they are just lessen, and there is a the improvement of the symptom, the improvement the less symptoms are there, and the improvement of the health is there, and the patient will be a little bit happy that she has not having pain. There is no menorrhagia, there is no pain in abdomen, there is no backache. But you know, all these drugs are just shortly acting, or the acting for the purpose. Means if you give OC pill, if you give progesterone only pills, if you give danazol, if you give painkiller, all these drugs are giving the results that the endometrium is going to shrink and the pain is going to be reduced, and but the patient is going to have lot of side effects in this type of endometriosis treatment in the modern science. So even there is some symptomatic treatment, like if she is having dysuria, if she is having constipation, if she is having other symptoms related to ureter, it means if the ureter is suppressed with the growth of the endometrium, then there will be hydroureter, and there will be some pain in the ureter, or there may be some collection of the urine or hydroureter. So these symptoms can be reduced with the help of the symptomatically acting drugs. But you know, the endometriosis to be removed is in the modern science. Now you either go for conservative surgery when the patient is willing for uh, fertility, or you need to go for surgical treatment. So what is the surgical treatment? The surgical treatment is nothing but laparoscopy, in which laparoscope is introduced inside the abdominal cavity. And when the laparoscope is introduced inside, you can always see the, all of you know that you can always see the structures. So you will be able to see the patches present, where they are present with your own eyes. You can visualize those patches, and you can just do the cautery on the same, in the same procedure. You can do the cautery in the same procedure. If you see the endometrium, you are going to cauterize them, laser them, and then there will be relief for the patient. And if there is a more involvement of the endometrium outside the pelvic, outside the uterus, then there are more chances of adhesions. The adhesions are present. Sometimes the rectum may has come closer to the posterior wall of the uterus. There are adhesions. Uterosacral involvement is more, there are adhesions. Bladder involvement is more, there are adhesions. So such type of adhesions are there. They are very much difficult to remove with the help of laparoscope also. Then we need to go for laparotomy. And if you open the abdomen, you can just remove this, all these things, abnormal things. You can remove the adhesions, you can go for adenolysis, and then all the anatomy is corrected and the abdomen is closed. So this is the treatment according to modern. First is drug treatment, second is laparoscopy along with cauterization, third is laparotomy, and fourth, there may be some combined treatment like laparoscopy with drugs. Means in the meantime, you go for decide for laparoscopy, you can give her danazole or progesterone like drug, or OC pill like drugs. There the endometrial length or the patches are reduced, and then you can go for laparoscopy. So combined treatment is also operated for the endometriosis. But the most important part is there should be relieving of the pain, and there should be complete removal of the disease. Complete removal of the disease is sometimes not possible, because there are chances of recurrence. If we go for cauterization, if we remove the patches, and if we go for cauterization, and again if we see that there is a recurrence of symptom, or there is a recurrence of the growth of the endometrium. So there are limitations. If we go for laparoscopy, if we go for laparotomy, then also we are not sure that the full disease is eradicated and we are successful in the treatment. So it is a very painful for the patient also, and she is very much depressed also in the disease. And the another important factor is she may develop infertility because of endometriosis, because in there is a menorrhagia, there is a dyspareunia also, deep dyspareunia is there if the patches are there in the pouch of Douglas, in the uterosacral. So coital act is not proper, and that's why there may be infertility. Due to adenomyosis, there may be infertility. Due to ovarian involvement, the proper ovulation is not taking place. Because of that, there may be infertility. And all these factors which are leading to infertility, they are making the lady very much sad, very much unhappy, and very much depressed. So endometriosis is a really a disease which is going to disturb the couple, disturb the wife. And of course, if they are married and if they are fertile and they have got their own children, it is very best treatment to go for hysterectomy, because that is going to totally remove the pain of the patient. And here, if the ovaries are not involved, you can go for total hysterectomy. You can keep the ovaries and you can go for total hysterectomy. And if there is a involvement of the ovary, like chocolate cyst, like ovarian mass, like tubal something growth, then you have to go for total, subtotal, and all those types of hysterectomies and abdominal hysterectomies, and you are going to remove the whole thing, and the patient is happy. The patient has now totally recovered from her disease. So that is the picture as we see according to modern gynecology or modern science. Now, all of you will see that Ayurveda has not mentioned any such a type of disease like endometriosis. You always see in the gynecology that we are having a limited number of diseases. That Charak Chikitsas Khan, Charaka has explained 20 Yoni Vyapadas. And these 20 Yoni Vyapadas are to be considered as the diseases of the Yoni. And when the lady is suffering from these Yoni Vyapadas, she is unable to produce a child. That is the main aim of Ayurveda. And that's why we must be able to just similarize, or just compare, or just try to go deeper study of these Ayurvedic gynecology, and find out with which conditions the endometriosis can be just similarized, or it can be taken into consideration, and we can treat the patient very much successfully. So, all of you, I am telling from the first that Shula is the most important symptom in these patients. Shula, which is going to disturb the lady, Shula, which is going to disturb the whole family, the couple, and the patient is coming to you again and again. So whatever gynecological conditions which are producing Shula in Ayurveda are always related to endometriosis. We can go for differential diagnosis, of course. For example, if we see Vatala Yoni Mappa, that is the first Yoni Mappa, which is the representing Shula. But Vatala Yoni Mappa, the lady must be of Vata Prakriti. She must be having all the symptoms of generalized symptoms of Vata Prakop, and she must be having all the symptoms like Sandhi Shul. She must be Krusha, like the just given the Vata Prakriti explanation in Ayurveda. So you have to see that whether she is having only pain at the time of the menstruation, she is having dysmenorrhea, or she is having pain all over the body. So you can differentiate it as from Vatala Yoni Vyapat. Secondly, Sushruta has narrated Vipluta Nitya Vedana. So Vipluta may be also taken into consideration for endometriosis. Third Yoni Vyapat is, of course, we all of us know that Udavarta Yoni Vyapath is having a lot of pain, severe pain, as we always see in endometriosis. So Udavartan of the Vata is present, and here the pain is spasmodic, the pain is colicky, and you need to remove that pain. And when you consider endometriosis, there is also some Vimarga Gaman of Artava, Vimarga Gaman of Artava. How? That when there is a retrograde when there is a retrograde menstrual fluid, when there is a retrograde or grading of endometrium, when the endometrium is just displaced away from its place, that is also Vimarga Gaman. So here also there is a Vimarga Gaman of endometrium into the outer side or into the myometrium, and that's why the lady is suffering from pain. So what is the involvement of Apan Vayu is also there, and involvement of Vyana Vayu is also there. So it can be called as Vyana Avrutta Apana. How? Because Vyana is responsible for all the movements all over the body, and it is just spreading, or it is just circulating the rasa dhatu all over the body, and Artava is a upadhatu of rasa, and that's why when there is some problem related to Artava, and when Vyana is involved, the Artava is going here and there, and it is producing some symptom. So again, there is an involvement of both of the Vayus. One is Vyana and second is Apana. So what we have seen up till Vataja Yoni Vapar, second is Vipluta Yoni Vapar, third is Udavarta Yoni Vapar, in which there is a severe pain which the lady can't bear and she is unable to do her day-to-day activities. Sometimes we compare it or study it as a primary dysmenorrhea also, or there may be secondary dysmenorrhea also. But here, most of the time in the case of endometriosis, this can be a secondary type of dysmenorrhea, because there is a congestion in the pelvic cavity. Because the endometrium is collecting, it is always proliferating, it is bleeding. So there is a congestion, and that's why it can be most of the time 90% of the Udavarta or 90% of the dysmenorrhea is secondary type of dysmenorrhea, which is present in this endometriosis. So here pain is the main factor. Now, if we go further, we will find Paripluta Yoni Vapor is also pain. Paripluta is having the main pain. Paripluta is dyspareunia, and that's why also Paripluta can be also considered when we think of endometriosis, because dysmenorrhea is also one of the symptom of endometriosis. But Paripluta is having combination of Vata and Pitta, and it goes towards some infection, it goes towards some Pittaja Lakshanani or Pitta Prakopjanya Lakshanani. So whenever we are thinking of this Pitta Prakopaja Lakshanani, the shul is there, but the shul is different, or there are some causes of infection. There is a congestive dysmenorrhea again in this Paripluta Yoni Vapor. But Paripluta Yoni Vapor can be considered for the differential diagnosis of endometriosis, and we can treat the patient as a involvement of Vata and Pitta. Now, if we go towards Kapha dosha, when there are adhesions, when there is a sticking of something, when all the organs in the pelvis have come together, the uterus has got attached to the anterior wall of the rectum, then ovary has got attached to the lateral wall of the uterus or anterior wall of the or posterior wall of the uterus. There is a big tubo-ovarian mass, and because of all these heavy things, the uterus is just displaced to backwards. Means there is a adhesion in uterosacral, there is a adhesion in rectum, there is a adhesion at the posterior wall. So what will happen? The uterus will fall backside. Then which yoni vapor will come? It is antarmukhi yoni vapor. So antarmukhi yoni vapor is displacement of uterus backside. So what may be the causes of the displacement of the uterus towards the posterior side? It may be endometriosis, or it may be adhesions. And when there are adhesions, when there is a stickiness, kapha will enter. So if we go stepwise of this pathology or samprapti of endometriosis, according to Ayurveda, if there is a only pain, then it is a vata. if there is a some secretions, means if there is a some endometrial or endocrinal secretions involved, then their pitta will enter, and when the adhesions are there, then kapha will enter. So when the severity of the endometriosis is considered, we can see that this is a tridoshaja type of disease. This is a tridoshaja type of disease. It has vata, it has pitta, it has kapha. So we need to treat all of three doshas whenever we are treating, when we are started with the endometriosis, and if we are considering at a as a yoni vyapat, you should see it as a tridoshatva. So even vatas, pittas, kapha, vata, pitta and kapha are involved. That's why it can be called as a sannipatik yoni vyapat also. And sannipatikatva comes when there is a chronicity. Sannipatikatva comes when there is a severity, and sannipatikatva comes when there is a very much severe symptoms of the disease. So accordingly, you need to treat the patient also, because she is very much tired, she is very much exhausted. So you need to work on doshas, you would need to work on srotasas, and here manova srotas is also to be considered very compassionately. You need to treat these patients, because they are suffering from so much pain, and they are suffering from so much means the very everything is disturbed in the life, and there is a pain, and there is every day she is having pain, and she is not actually um, uh, just able to enjoy her life and all these things. So here the manobhav srotasa will also enter when we are thinking about correcting the artava srotasa. So if you go accordingly, doshas nahi vata dhrute nari, so you have to consider about vata first. So vata shodhan, you need to think about shodhan, and shodhan is to be done in vata prakriti or in vata. All of you know basti is the sarvottam chikitsa for shodhan of vata, or for just coolifying the prakopa vata. You need to go for basti to collect. And even all the yoni vyapadas, if we see the samanya causes of these yoni vyapadas, samanya karanani of these yoni vyapadas, which Charaka has mentioned. So these are just mithya ahara vihara. So mithya ahara vihara is the first cause which Charaka has mentioned. And what is mithya ahara vihara? Mithya ahara vihara is going to cause ama production. When ama is produced, that ama is going to produce the just flow all over the body, and then there will be just disease, there will be pathology of the disease. So every disease to be considered when you treat, first go for amapachan of the lady, go for some laghu type of diet, some diet which is just responsible to be very much light diet should be given, so that vata prakop is considered. And go for basti first. First you need to go for snehan svedan, so that all the doshas are collected. Then go for shodhana. Here you need to go for basti first. You can go for yoga basti, or you can go for a treatment of bastis like lekhan basti, like some pain removing. If you want to give, you can use erandamul tel basti, or such a type of basti can be repeated in the lady. Or for, according to me, yoga basti is the best treatment for as a first step towards this patient. Then you have to pacify the vata by giving the light diet and giving her diet which is just opposing the vata. Then you have to need to treat her manova srotasa by giving shirobhasti, or by giving shirodhara. Then she can come to normal. After that, you have to need to think about pitta. Then you again go for snehan svedan and virechan. And whenever you are dealing with these two doshas, I think automatically kapha is also going to just calm down during this process, because kapha is development of kaphaja lakshanani is when there is a increase in the symptoms of endometrium, like adhesions and all that. That may be the last stage of the endometriosis. So first there is a localization, sublocation of the endometrium. Then the endometrium will produce symptom, and then there will be some formation of scars and formation of adhesions. So kapha is going to enter last in this process. So let us keep aside kapha and let us treat vata and pitta first, and after that take a judgment that whether you have considered whether the kapha is just control, whether the kapha has calmed down because of these two treatment. Then you can use some oral medicines for this. Some oral medicines which are just okay for the prakriti, as you see the prakriti of the patient, and then you can use the oral medicines in this patient. Like all the time you are going to use amapachak kalpa, that is amapachak bati. After that, if you want to uh, use for dysmenorrhea, pippaladi, quat can be used. Sukumara bhuta can be used when there is a dyspareunia. And in menorrhagia, of course, all of you know that Ashoka is the best drug in menorrhagia. But here, as there is a involvement of Vata and there is a shul, you can make a Ghuta or with Ashoka, and you can use the Ashoka Ghuta or Ashokadi like Lodhra and all these things. It means you go as per the symptoms and you see whether you what drug you need to use, but you first see that the drug is accompanied with some vatahara dravya or the anupan used for this dravya, or if you use any type of ekeri churna, that is a single churna like lodra, like ashoka, the anupan used can be ghuta or taila. So because of that there will be vata shaman, there will be also suppression of menorrhagia like symptom, there will be also just good nutrient or good support to the uterine muscles, and then the drug will be active because of like ashoka and lodhra type of drugs can be used. Of course, every time where I always suggest that whenever you use the drugs, you are going to see the prakriti of the patient, bala of the patient, agni of the patient, and you have to see that there is a there is always the treatment available in front of you. You can use some churnas in a singleton way, or you can make a mixture of them as per you think that what the patient needs and how her agni is and how her bala is. Sometimes the patient is having severe symptoms but her bala is better, that at that time you must select the shodhan chikitsas as per her bala, and she can be get cured very early. But if the patient is having the bala is not that much as you think, she is responding to you, or she is very weak with mind, and she her manohar sotas is very much in fact very much affected because of this disease. That time you need to go for some shamana treatments. Shodhan is not that much useful. The shodhana is going to deteriorate her condition. So according to the condition, you need to treat, and you are going to just detoxify the patient's body, detoxify her mind, and detoxify the disease from her body. You have to remove the toxins, and you have to go for see the Srotasa involvement. Of course, her diet, her other drugs are to be taken care of as per your own practice and your own experience in your Ayurvedic dravyas or Ayurvedic drugs. And there are so many drugs available in the market. There are so many drugs which you can use, but you have to use your experience in that. Always don't go that you are spoon feeded by the teacher, or you are just given some names, अरे अरे endometriosis है मैं ना ये काम करता है, ऐसा नहीं होता. हम लोगों को बहुत स्टडी करना पड़ता है कि हाउ द कैरेक्टर इज इन सिटिंग इन फ्रंट ऑफ अस. Character means the patient who is sitting in front of us, and we need to study her, and we need to use the drugs which are available at our place, which are available at my OPD, which are available at my market, and which can be given. Dashamula will be the best option, as all of you know, because Shula is the main culprit in this disease. And of course, one rasayan is every time given to every woman in our society, because she is always very much disturbed because of her illness. As she is disturbed, her family is disturbed, and she is feeling very guilty about it. So she needs a good rasayan like shatavari, like ashwagandha, along with the treatment which you are giving to her. And her diet should always have ghruta in her diet, taila in her diet, and she should always take better rest. That is the most important thing. The better rest means ahara is to be looked after, and in vihara she always needs rest whenever she is suffering from any such a type of big disease, such a type of big syndrome which is going to disturb her for her own sake. If she is working lady, it is so difficult. Even if she is housewife, it is so difficult. So rest is must whenever you are going to start any treatment. It is not like that you will start yogasti, then she will come running away at our place, and you will give her basti, then she will go to work and like that. You are not going to treat her like that. So just look after that you are having a proper treatment with a proper rest for the patient. And I think it was enough knowledge for all of you, and I thank you, the organizers, for giving me chance to express my views. And thank you very much.
Yes, thank you, ma'am, for your very scientific, informative knowledge. If you have any question, then we will. Actually, two people are asking question. After that, we will proceed our program. Dr. Vaishnavi Golab is asking, ma'am, which endometrium is involved in menstruation process, externa, interna, or both?
Which
endometrium is involved in menstruation process?
Endometrium is the endometrium only, uterine endometrium.
Okay, okay. Dr. Sanjay asking that which asana are supportive in addition to said about treatment to the relief pain? Asana.
Asana.
Yes.
Yeah, asanas. Here I was talking regarding the bala of the patient. We have to see first whether she is that much cooperative to you to seeing to do any asanas, because I am very fond of asanas all the time when I treat women. But here I will suggest that first let us cover her weakness, let us cover her first Tridoshagna in her body. And here we can only suggest the Shavasana or some type of Supta Baddha Konasana. Supta Baddha Konasana is very much effective in this patient. Baddha Konasana we are doing in sitting position. Upavishta Konasana we are doing in the sitting position. But here, as we need more relaxation of mind and more relaxation of body, we always should go for Shavasana and Supta Baddha Konasana. These both are most important, and Upavishta Konasana is also important. And really, it is very useful when the patient has covered a lot. Then only we are going for other vigorous asanas like standing asanas, sitting asanas. But first, give her only Shavasana and only Supta Baddha Konasana.
Okay, okay. Thank you, ma'am. Dr. Monica is asking which arrest, Dr. Monica is asking that which arrest is effective in the adenomyosis treatment, ma'am? Arrest.
Which Arishta?
Yes.
Dashamula Arishta is the best because it is a all play of Vata. So that can be given to the patient in a very the dose of it, or the maybe more also you can give it as a 2 TSF TDS.
Okay. Thank you, ma'am. Thank you. Yes, Dr. Kalyani Hubre, yeah, we have allowed you. What is your question? If you want to ask question, you can unmute yourself and you ask the question. Dr. Kalyani? Hello, yes, Dr. Kalyani, you can ask. Okay. Okay. Yes, now I would like to request Dr. Bhavani sir to express vote of thanks, and after that we are going to declare the result of the quiz which we have taken on behalf of World's Women Day. Being women, we should respect their, nowadays women are in every part, in every sector of in the current scenario. So we always, kind of respect should be always towards the mother, sister, and every woman, not only every woman in the society. So on behalf of that, we have conducted quiz for that, and we are giving the cash prize also, and some ARCA point also. They can avail this point for their some other useful some services we provide. For example, we have the journal publications, and we also conduct some program here, so that they can avail this ARCA point. So just so now I would like to invite Dr. Bhavneswar to express vote of thanks briefly.
Thank you, Dr. Sundar. Very informative and knowledgeable lecture delivered by Madam. She shared her experience with all of us, and without using any PPT. Matlab, since last 1 year, 1 or 2 years, we are used to with the PPT, but without using PPT, she delivered the lecture, very informative lecture.
That's
and
very well.
knowledgeable lecture. Yeah, thank you very much. And very short notice period, she accepted the request, and despite in spite she is in the traveling, she accepted the request. Thank you very much, ma'am, for giving such a nice lecture. I would also like to thank the ARCA directors, Dr. Sundar Singh Danga sir, Dr. Chetan Gullane sir, Dr. Neha, coordinator ARCA, and all the participants who are present for this lecture. Thank you once again.
Yes, yes.
Over to Dr. Sundar.
Yes, yes. Now I would like to share. Would like to declare the result of our quiz. So please be wait for a single minute, not more than that. Of that quiz. So I would like to congratulate all the winners who have participated. On behalf of first winner is a
Audio Jungle.
You are the first winner, and you will get the 1,000 rupees, means 500 cash prize, and 500 as a ARCA. So please make ready your mobile number, account linked with your bank. Okay, so congratulations, Dr. Rinku Tijare. If you are here, then you have to just raise your hand and show your identity, so that we can transfer the said amount. Now, second winner is Dr. Priya Raut. Is the second winner. So you have to just show your identity, Aadhaar card or PAN card by raising your hands, so that we will transfer you 50% point in your account, and you also provide the bank detail as well as the email. Yes, Dr. Rinku, we have unmuted you. Just show your identity card. Yes, Dr. Rinku Tijare.
Okay, sir.
Yes.
I cannot on the video.
Okay. I have make you panelist. Accept that one. Accept that request.
Sir, I haven't received the request of panelist yet.
Okay, just 1 minute. Now, please check. Yes, I will make you co-host now, so that you will be able to. Yes. Identity. Dr. Dr. Rinku Tijare, from where are you?
Okay, sir. I am from Government Ayurved Nagpur.
Okay, congratulations, Dr. Rinku.
Thank you very much, sir.
Yes, yes. Now, please give me your account details so that I can transfer your amount, said amount. You are the first winner.
You can use my mobile number for the same, sir. Any Google Pay, Phone
Yes,
Pay.
yes. No, tell me your mobile number. I am sharing my here. Yeah, I will put here your mobile number. Are you looking my screen?
Yes, sir.
Tell me your number.
98
98
23
3
40
40
45.
4541. Yeah, I have your number. Yeah, is it correct now?
Yes, sir.
Tijare, okay.
Yes, sir. Right.
Okay. Now online I will transfer you. After received, just show your screen here. Okay, your account is linked with State Bank of India. Yes.
Yes, sir.
Yes, I am now transferring you. You will see it on screen.
Okay, sir.
Yes, have you received it?
Yes, sir. Received it.
Okay, and 500 will be, you will get the ARCA point, a certificate for that. For that, you have to use
Okay.
correct email on our arcexpert@gmail.com. So that we will send you coupon code for that. Okay.
Okay, sir.
Okay, okay.
Thank you for this initiative, sir. That quiz I filled was 6 बजे close होने वाला था. मैंने 5 बजे भर के भेजा है वो. Late link receive हुई थी.
Okay, good. So next is clear out is there. Clear out. Clear out is there.
Priya Raut. Priya Raut. Can you listen us?
Priya Raut. Is she present in these lectures? Dr. Priya, someone is Dr. Priya here? Yes. Dr. Priya Raut, she is the second winner. Yes, Dr. Priya, are you Priya Raut? Hello? Yes, Dr. Priya?
Hello,
Huh.
sir. Dr. Priya, not clear out.
Priya Raut.
Okay. Sir, I think she has not joined. Priya Raut has not joined.
Hello,
This
sir, may I take permission to
Yes,
leave?
yes, ma'am. Sure, sure.
Yeah, thank you very much.
Yes, yes.
Sir, I think Dr. Priya Raut is not there.
Okay, okay.
Contact her later.
Okay, so okay. We will contact her later and we'll take. And now I will just share that email with that I think ARC expert. I will put it in chat box so that Raut will mail us and we will send her coupon code for that. Okay, Dr. Rinku. Yeah, I have put your email here. You have to just send us email.
Yes, sir.
Yes, you have to send your name, email, and address here. We will send you certificate and ARCA coupon code for 500. Okay.
Okay, sir. Where should I send this?
Yeah, I have put your email in chat box. arcexpert@gmail.com.
Okay, okay.
Even if your that friend is there, Dr. Priya Raut is also. If she is your friend, inform her.
Okay.
She has won the second prize. Okay.
Yes, sir.
Okay. So now Dr. Chetan would like to express the vote of thanks for overall program. So Dr. Chetan. Yes, Dr. Chetan, just express vote of thanks for overall program. Okay, I think Dr. Chetan is quite busy in some work. Okay, thank you all the participants, all the respected our chief guest today, Dr. Patil ma'am. She has given valuable time to express and to deliver the scientific lecture on endometriosis. And many participants have asked the question and even they satisfied with the knowledge. Even without showing any video or PPT, ma'am has, could have been presented very well in a simple language. So thank you really, ma'am. And I hope you will also join in future also for any other program. So really thank you, Dr. Patil ma'am, and thank you all the participants who joined today's session, today's program. And lastly, I thank you all my colleagues, Dr. Neha, Dr. Bhavnesar, Dr. Chetan. And again, congratulations, Dr. Inku Tizare and Dr. Priya Rao for participating in human-based quiz competition. And in future also, we are going to conduct various competition on behalf of Ayurveda Research and Career Academy. So once again, thank you, and all we will close here. Thank you.